Ayoola here from Muscle Management Services, and this is my friend Jamila.
Hi.
We are doing a prenatal massage technique video today, and I'm so excited because I got Jamila before this baby drops. So Jamila,
Yes.
let us know, what's the deal with this pregnancy?
This pregnancy has been different than my other two. I think because I'm a little bit older, and when I got pregnant, I wasn't really in the best of shape. So it's been really painful on my abdomen muscles, my hips, my knees as well. So it's been tough, especially my third trimester.
Okay. And then how many children do you have?
This is my third.
Okay, so we're on baby number 3.
And last.
Have you gotten prenatal massages with your other children? Do you feel like you needed it?
I did with my second child. I did in my towards the end of my second trimester.
Okay.
I got maybe 1 or 2.
Okay. And then how often or how many massages have you got for this pregnancy?
I've only gotten 1.
Okay.
Yeah.
So I saw Jamila a little bit ago. So
Yeah.
So this is gonna be your second one. And then how far along are you?
I'm 36 weeks.
Okay, so yeah, what, 4 more weeks?
Yeah.
Wow, a month. So what areas you feel like you need most work with?
Okay. So my hips, because I think he did drop.
Okay.
So I'm getting close. So my hips are really bothering me. My lower back as well because of the weight, and my shoulders as well. I don't know if it's because my milk is coming in, but that's giving me some issues. Yeah.
Okay. And then how's your pregnancy? Do you have any medical issues or anything?
Well, I am considered high risk. My first child was premature, so all of my additional pregnancies are high risk, and they do give me like certain procedures and precautions just to make sure I don't go into preterm labor.
Okay. Well, you are cleared for prenatal massage.
Yes.
All right, I just really wanted I wanted Jamila to mention that. I'm so glad that you were able to share that, because I just want a lot of women to know that even if you are having a little bit more of a high risk pregnancy, there's a potential that you may still be able to enjoy prenatal massage and just get some relief. So I just want to thank Jamila so much for coming in and being my massage model. And we're going to get started in a little bit. So I hope you guys enjoy this video. Bye. Hey guys, we're back. We have Jamila here on the table. And before we get started, I just wanted to also mention that the purpose of this video is to inform some of you who are interested in what happens during a prenatal massage. So maybe if you're thinking about getting one, you know what to expect. But also, if you've gotten clearance from your doctor, some of you may have a friend or partner who might want to try some of the techniques that I'm using. Just remember to always communicate to the person you're massaging, and for the person on the table to always make it a priority to communicate what they feel. You don't want to hurt the mommy or the baby, so just keep that in mind, okay? So in order to make mommy comfortable, we are gonna start with having her lay on her side. We have a pillow here. I'm using the headrest from my massage table as a pillow. It's a little stiffer than a normal pillow. We also have an additional pillow here. If you want, you can use one of those prenatal body pillows, or you can use 2 standard size pillows. So she's hugging this one, and what it does is it makes her shoulders a little bit more square. So when I'm pushing, she has something to kind of balance on and hold on to, and it makes it a lot more comfortable. We also have an additional pillow here. So her bottom leg is back and her top leg is over this pillow, and it helps with the placement of her hips. She's also in a very comfortable, almost like a fetal side-lying position. So for neck and shoulders, I am actually standing right next to the table, and I am going to use long strokes to massage Jamila's neck. See, I can access it here, which is another thing that I like about having that pillow that I have. I can still access her neck. and one shoulder. For prenatal, the idea is you do one side first, and then the mommy switches, and then you do the other side. So first we're going to use lotion. I use Sacred Earth, but any type of oil, vegetable oil, if you really have nothing. Regular lotion, like body lotion from the pharmacy, sometimes pill when you massage. So if you don't have a specific massage cream or oil, use a cooking oil, olive oil or vegetable oil. So I warmed it up. How's it feel, Jamila? And you just try to start with getting your hands used to the surface and also spreading the lotion around. So for neck, I like to use this motion, and you can start with a firm pressure right at the lower sides of the shoulder and neck area, and then as you go up, you lighten up just a little bit. But you can also always ask for feedback if this is the first time you're doing it. How's this?
Good.
All right. And for those of you who don't know, I am actually a mother too. And I kind of remember, my daughter's 8 right now, the shoulder issues. And when your milk starts coming in, you feel sensations from this area of your back, right, Jamila?
Yeah.
So Jamila's almost ready. So her body's getting ready and her shoulders are hurting a lot. So as far as neck, it doesn't have to be complicated. That one technique and another one, you can use this hand to just pull at the traps. So the top edge of traps actually attaches to the top of the head and it comes down and creates the shoulder. So if neck is bothering you, you can just pull. And just because a woman is pregnant doesn't mean she can't enjoy a good medium to firm pressure. As you can see, her skin and muscles move. I'm not using extra light pressure. She wants to feel relaxed because her body is working hard. For shoulders, a good technique is to just start at the top of shoulders with like medium pressure and then pull down and do a little bit of deeper pressure, and then follow the areas in between the scapula and the spine. We're never massaging spine, and if we rub on the bony parts of her scapula too much, it's just gonna make her skin sore. So we just try to move along the inside area. And that's actually the path in which traps and some of the muscles below do a lot of work. And so right now I'm doing like little circles with my thumb out. You can do them in too, if that feels good to you. I like to do them out. Or you can do them down. Short strokes feel really good in between shoulder blades because there's a lot of muscles that work really hard. I'm squatting now and I'm going up. You can do that all the way up. And then that same technique I was doing before, just pull down. So I'm not sitting down for this. For a lot of prenatal, the back especially is a seated position. But right now I'm either standing or squatting. If Jamila wanted do you want some serious shoulder work? Like medium pressure shoulder work or not really? All right, so if your mommy is having some serious shoulder pain, like Jamila is, then you can start taking some deeper, longer strokes with your thumb. If your hands are struggling a little bit, you can use your other hand to assist. And you're trying to relax, trap, and unroll it. Trapezius muscle, the top of it, rolls around to create the shoulder. So think of it looking like my fist right now, like that. And then we're using the massage to go in and uncurl it a little bit, okay? How's this feel?
That's amazing.
Okay. So I'm using like between medium and firm pressure. Her skin and the flesh is moving, but I'm not digging down. I'm using all of my fingers to apply pressure, and I'm not digging or poking or prodding. Now we're gonna start on the back. We just finished the shoulders, and you can actually feel the shoulder loosen up a little bit. You should be able to feel that. I've already went ahead and lubricated Jamila's back. So the first technique is a relaxing technique. It also can be used for just spreading around the lotion, but it's just really relaxing. And if mommy's having a tough day, you can probably just do this one technique and she'll be all right. The human touch is so powerful. So we just have our hands fully engaged with the skin, and we're moving our strokes more so upward as far as pressure, and then we're lightly dragging them back down to the base of the spine, push upward. So this is called effleurage, and this is a basic massage therapy stroke. It's the first thing we learn when we go to massage school. All right, another basic stroke that I like to start with, I'm gonna call it kissing ducks. So this is the duck, one duck. You can do one duck like this. I like to do kissing ducks where they intertwine. So you can start one duck up by the neck, and then kissing ducks all the way down towards the base of the spine. Remember, we are not massaging on the spine. We're massaging on each side of the spine, which have a lot of really important muscles that help us stabilize our back. When you go down to lower back, you can feel where the hip bone is, and you're not massaging on that bone because the skin is going to get achy. You're massaging to that and getting a little lighter, and then your kissing ducks go all the way back up towards the neck. So you can do that a few times. So that's a good warm-up, the kissing ducks. It also helps you to kind of feel out where the tight points are in the back. So as you're going up and down, you're noticing if there are any areas that are tighter than other parts of the back. Next technique, we're gonna do thumb spirals. So I'm sitting down on a stool, by the way. I forgot to mention that. So you can kind of position the stool to where your knees are facing the neck, and then push in with your thumbs, and also use your body as leverage to give some good pressure. How would you describe this pressure, Jamila? Medium or firm?
Medium.
Medium, yes. So we're just along, we're not pushing on the spine, we're pushing on, you should be able to feel the muscle mass along the sides of the spine. And we're just doing thumb spirals all the way up. Right in here, you might feel a little pop. That's her trapezius muscle. I was talking about that earlier. It helps to create the shoulder. So if you notice that, that's not a knot. It's just the edge of that muscle. And a lot of times, Jamila's is right here. It's popping a little bit. A lot of times people think it's a knot, but it's just the fibrous edge of that muscle. It goes all the way up to the shoulder. So do that a couple times up towards the shoulders. Thumb spirals. You can go, I like to massage slow, and it also helps mommy to relax a little bit. Maybe baby might relax a little bit. If you don't like thumb spirals, you feel like you don't have enough strength in your thumbs, you can do the thumb push and just push. And effleurage down, spiral, or push. And with medium pressure, those muscles should eventually relax. Now for a little bit more specific detail, if, for example, Jamila's having some lower back tightness, I'm going to do an erector pull. And erectors are those muscles along the side of the spine. So you're going in from the side, and you can either push with your thumb, or you can push down, pull down with your fingers like that. So like you're grabbing a lever, just pushing it down. Remember, you're just using moderate pressure, and you're not pushing into her belly or the baby. You're pushing down towards the spine, not on the spine, but towards the spine. If you're nervous about this move, start at her ribs. Her ribs are protecting her insides, and you can push down, and that might give you a good indicator on like perfecting this technique. So this is a good technique. It kind of loosens the connective tissue that is keeping all those layers of muscles in place, and it works really well in lower back. For lower back, remember the baby is taking up the space in between the rib cage and the pelvic area, so don't rest your hand in the soft part of the waist for the mom. It's going to be really uncomfortable for baby, mommy, and just remember that's like a no-go zone, so just try to avoid that. Even with this technique, we're going closer to maybe like 2 or 3 inches away from the spine, but not above that. You can do this all the way up until you get to the area where trap starts. And you can go back to your thumb spirals. How's that feel, Jamila?
Good.
Grabbing my lotion. All right, and now once you feel like you've done enough of those techniques, always end with an effleurage. I just like it because it's like putting that part of the body that you just massaged, putting it to sleep, letting it know that it needs to continue resting. And it feels really good. All right, so we'll be back and we'll work on hips. Okay, we're back and we are going to focus on hips. I think it is definitely possible to not notice your hips until you actually get pregnant. Because these babies start to act up. So for my prenatal mommies who are interested in getting massages, you wonder if you should keep your underwear on and off. It's an option, whatever's comfortable for you. A lot of my prenatal women like to keep their underwear on, but once I start to massage hips, a lot of times I try to bring the underwear down a little bit, and that just the ability to be able to glide over that and get in and feel what's going on without the underwear being there. By the time they come back again, underwear is off. You just want to be able, you want your massage therapist to be able to kind of feel what's going on in there. And for massage therapists who tend to stay away from glutes because they think it's creepy, you just have to teach your hands how to do it in a not creepy way. If I'm going into glutes, I'm doing like a layered hand, because a hand like this, if my hand was spread out and like that, what does that feel like, Jamila? Like I'm about to cup your butt, right? Yeah. But when your hands are stiffer, more intentional, that's the precise word, intentional, it doesn't feel as creepy. So try to touch hips and glutes as a therapist or the practicing person with 2 hands that are a little bit stiffer and not relaxed and like grabby, okay? So the first technique, we're gonna start with our fingers going in like an arrow position, and we're gonna go in gently, slowly, and get as far as we can and hold it. And I like to do this across hips because they're very sensitive, but they need a lot of attention, I would say. Lowering your fingers by about a ½ inch each time and really trying to work through all those layers of they're like 3 layers of glute muscles. We're going almost towards like the center where her, the separation of her buttocks are. Derriere. And then you can go back up with that. So, and Jamila brought up a really good point earlier. She said she liked when I did the massage slow, because if you're struggling with nausea, as she was this morning, it doesn't agitate her stomach and make her more nauseous. So that's a really good tip for anyone practicing this who's new, just try to go as slow as possible. I try to do it in general for everyone, but especially with a prenatal massage, just take your time and go slow, because you don't want, mommy getting upset and having to cut the massage short because all the vibration and quick movement made her sick. All right, so this next, you can do the duck. Duck looks a little different, but it still feels good. And hips. And you're just kind of moving everything around, moving the blood around. And the kissing ducks. How does this feel, Jamila? Okay. All right, so I can actually feel the tight mass here, close to the belly of her glutes. So I'm going to spend a little bit of time here. But I hope you guys enjoyed this video. And when I'm done her glutes, I'm just gonna go back in and do her entire back and effleurage, and just double check if we missed any tight spots with her. We're gonna go in there and do a little bit more detailed work with some of those same techniques that we learned. Massage doesn't have to be all, interesting, weird things with your hands. It's very simple, and it can still feel good and be efficient. Hope you guys enjoyed. Okay, Jamila has just finished her second prenatal massage. She's 36 weeks, and little Langston is gonna be here probably by the time I drop this video. So Jamila, how are you feeling?
I feel amazing. From my shoulders, because they say the baby gets the best circulation laying on your left, so I have to lay on my left a lot, which means my shoulders and my hip was giving me a lot of pain. I feel zero pain, even to a point where I don't feel like I even have to waddle when I walk, because I think I waddled because of the being uncomfortable, and now I just feel like I'm walking normally. So I feel amazing.
All right, well, you've heard it from a real life mommy to be. She's already a mom. I just want to say a big thank you, Jamila. Thank you for coming out and being my massage model. And all you pregnant ladies, do not suffer. Don't go through the pain. There is some relief out there. And then to all the mommy's partners out there, try your best to make them feel better. They need it. And I hope some of my tips helped you guys. And enjoy your pregnancy. Remember to like, share, and comment. Please let me know if you would like more videos like this so I can create more content for you. Thanks so much for watching.